Most people think that paying for healthcare out of their own pockets, including the Abbott government's $7 Medicare co-payment, is a bad idea. In America, private spending on health is high. So is the total cost of the health system, and health outcomes are low. No wonder people think we are better off with a system like Medicare, where the government pays for healthcare courtesy of taxpayers. The problem is that Medicare is unsustainable in an ageing Australia. The cost of health will need to be shared if the health system is to be affordable. There is a country that has a very affordable health system because individuals take greater personal financial responsibility for health. Singapore spends under 4% of its national income on health each year. This is less than half the amount spent in Australia, the UK and New Zealand, yet Singapore's life expectancy exceeds life expectancy in all three countries. What makes Singapore's health system unique is the Medisave system of health savings accounts. Similar to Australia's superannuation system, all citizens in Singapore make compulsory income contributions to their tax-effective Medisave HSAs. These funds are then used to pay for health services and hospital insurance. Minor health costs, such as GP visits and most prescription pharmaceuticals, are paid for directly out of pocket. Greater self-financing is the secret to Singapore's success in containing health costs. The government funds just 41% of health spending in Singapore. More importantly, Singaporeans pay for over 50% of health spending out of their own pockets, and private insurance in Singapore covers less than 9% of health costs. In the United States, by comparison, private insurance pays for 41% of health spending. The lessons of Singapore could be applied in Australia by allowing people to opt out of Medicare and establish their own health savings accounts. If you opted out, you would trade your Medicare entitlements for an annual health voucher for deposit in a health savings account linked to your superannuation account. The voucher would be worth average per person government spending on health, approximately $4,300 in 2011-12. You could then use the money in your HSA to purchase health services and pay for health insurance. The financial advantages of opting out would make HSAs an attractive alternative way of paying for healthcare. Most importantly, HSAs would contribute to the sustainability of the entire health system. In the 1990s, in response to the challenges of population ageing, Australia began to move from relying on a pay-as-you-go, taxpayer-funded public pension towards a save-as-you-go, self-funded superannuation system. Opt-out HSAs would replicate that transition for health services and emulate the ways Singapore has created a low-cost and cost-effective health system.